Good morning. Welcome to Bevel State Community College, Fayette Campus. We are so glad that you are here today for our Black History program. I want to commend the Diversity Committee for putting this program together. If you're a member of the Diversity Committee, would you please stand for us? We do have another school that should be coming in shortly, but we wanted to go ahead and get started so that the others who have to leave will be able to leave on time. I'm Sherry Terry. I'm the Director of Student Services on the Fayette campus, and we're just so excited that you're able to be here today. I want to welcome Aliceville High School. Woohoo! And those of you from Fayette County High School. And of course, our Bevel State students, along with our faculty, staff. We do have Dean Weaver with us. He's standing in the back. He is our Dean of Academic Transfer. Thank you for being here today. And we have several, Tim Estes, he is our Division Chair of the Academic Division. And then we have several of our faculty and staff that are sitting in the back. So thank you all for taking time out of your day to be here. And if you ever need us, you know, Bevel State, we're your community college, and you just let us know how we can help you. I'm going to turn it over to Ms. Alexandria Henry.
Good morning, everyone. I will be reading you all a poem titled Dreams by Langston Hughes. Hold fast to dreams, for if dreams die, life is a broken-winged bird that cannot fly. Hold fast to dreams, for when dreams go, life is a barren field frozen with snow. Thank you. Jeremiah Malloy will come up to introduce our speaker for the program.
Good morning. My name is Jeremiah Malloy, and I'm the network manager here at Bevel State and for Carrollton as well as here. Our speaker, Dr. Torrance Green, is a self-proclaimed country boy from Bolton, Mississippi. Bolton is located 20 miles from the state capital of Jackson, Mississippi. Dr. Green is a graduate of Xavier University in New Orleans, Louisiana. After graduating from Xavier, he attended Tulane University in New Orleans, where he received a Master of Science in Public Health, a medical doctorate, and a Ph.D. in physiology. Dr. Green conducted research at Tulane University in hypertension and renal hemodynamics. He worked in internal medicine at the Ochsner Clinical Foundation in New Orleans. Since returning to Mississippi, he has treated hospitalized patients at the following centers: Merit Health, River Region in Vicksburg, Mississippi, Baptist Memorial Hospital Golden Triangle in Columbus, Mississippi, Select Regency Long-Term Acute Care Hospital in Hattiesburg, Mississippi, and the Department of Nephrology at the University Medical Center in Jackson, Mississippi. Dr. Green contributes to many community service events throughout the Mississippi Outreach Foundation. He's a member of Kappa Alpha Psi Fraternity, Inc., where he served as past president. He is a member of Chapel Hill Missionary Baptist Church. His most cherished role, however, is that of father to Ivy, Kilby, and Milan. Please give a nice, warm welcome to Dr. Torrance Green.
Well, good morning. Good morning. Oh, that's what I'm talking about. I thought I was going to have to call ski up here, somebody get a response. All right. I'm Dr. Green, and most of you will not have a chance to see me because y'all are too young, and I hope that to be the case as we kind of discuss this issue about health disparities. But I want to tell you before we get started, this is not going to be that lecture to tell you how bad things are. This is not going to be that discussion about why you don't have any hope to overcome things. And so what I want to do, first of all, is let y'all who didn't get any sleep last night and who ain't going to listen to much of what I say, I'm going to give you the punchline up front. Somebody of authority somewhere in your life is going to tell you and make you aware of why you are different, why you are disadvantaged, and why you should not succeed. And then they are going to manipulate you by giving you some false bit of information, which I'm going to call artificial intelligence. That leads you to make a mistake, and not just one mistake, but several mistakes that leaves you in a desperate state. Now, and when we talk about society, what we're talking about is health disparity, but in your own individual lives, that's going to lead to some state of desperation, all right? Now, y'all go to sleep. Now, everybody else, I just want to thank you for your attention. I want to thank Ms. Stephanie Berry for arranging this program and giving me the opportunity to come and share some things with you. And I just want to start off with a quote. What we need is not a history of selected races of nations, of natural kind of bias or rate hate. What we need is a celebration that is void of all those things. And this is a quote that comes from The Miseducation of the Negro, written by Carter G. Woodson. He's the initiator, and he established Black History Week, which is the progenitor of the Black History Month that we've kind of assembled here today to celebrate. However, when we talk about healthcare disparities in this context, I want to refer to another quote. And it says, "When you control a man's thinking, you do not have to worry about his actions. You do not have to worry about telling him to be here or go yonder. All you have to do is let him find his quote-unquote proper place, and he will stay in it." And I submit to you that the African-American community has found our place in the lower rungs of several metrics of healthcare disparities. These metrics, I would submit further, are the result of constant neglect. And not just neglect of systems. Of course, we know how hard it is to see doctors, how our hospital systems are often underfunded, but it's a neglect of the mind. And the question that I'm going to ask you is, how do we watch one another suffer the way we do if we have not been somehow programmed into it? I submit finally to you that this programming has a term that I will use today just to sum up as artificial intelligence. Now, artificial intelligence, what is it? That's a vogue term. Everybody's talking about AI. Most of y'all in high school, I know y'all are playing with it. Y'all have probably submitted somebody else's work and called it your own as a result of AI, but I'm not even going to go into that, right? But when you look at the two terms that go into it, artificial, yes, that it relates to our current condition in that it is somewhat man-made. And certainly and the part of intelligence is relevant in that it refers to the ability to seek and apply knowledge and skills towards a particular purpose. But see, when we put the two terms together, it creates something a little bit more sinister, something a lot more complex. In fact, so complex that the United States Department of State, as well as the Congress, had to actually pass an act, the National Artificial Intelligence Act of 2020. And today, I'm going to use that definition that they include to kind of guide our discussion. Their definition is that it is a man-made, excuse me, the internet's tripping. It is a man-made state that, when directed by human-derived objectives, influences decisions, recommendations that then determine real and virtual environments. Now, let me go through that again, because these parts are important, and we have to kind of understand the world that we're going into. It is a man-made machine, all right? A man-made machine that, based on a set of human-derived objectives, influences recommendations and decisions that then influence real and virtual environments. So, in our real life today, how does that work for us? How does it lead to where we are? Well, I'm going to tell you, I think this term artificial intelligence, AI, not in the computer sense, but in a general sense, has had several names in the past. I'd argue that apartheid, the caste systems, and specifically slavery, are the results of this type of programming, this artificial intelligence by which some man-made objective leads to the influencing of other people's real-life environments. I'm going to give you another example, how the Holocaust, it implied applying a certain artificial genetic intelligence to Jews as the idea that they were contaminants of an Aryan genotype. And further, since probably a big proportion of folks in here are women, I'm going to say that it also refers to sexism, in that it applies an artificial biological intelligence that in everything that is applied, that women are always going to be at a disadvantage. And so the complexity of these terms, you can understand, has a real way of setting one side versus the other side, depending on the human that is the one that is determining the objectives. Now, all right, so now when we put those together and we talk about our current state of healthcare, I want to just first of all add to the idea of artificial intelligence two terms. First one is the disparity. Everybody knows disparity in here. So wait, pop quiz. Everybody close your eyes. Real quick, close your eyes, right? Spelling pop quiz. We're going to spell disparity. First letter is D, all right? And the next letter is, wait. All right, you can go open your eyes. Because the question is it an E or is it an I? Just in the very spelling of disparity, just in the very spelling of it, there's a certain bit of confusion. And the reason that is partly because the words despair, as in the Greek, it comes from a Greek word of splitting things in two, as in to dis, not pair, right? Pair meaning two, all right? But often despair can lead to despair, D-E-S-P. All right, and so disparate states, or when you become aware of a difference, can get to the point where people stop even making the comparison, to the point that you are disparate. And in other words, there has been a time in our history where there was no comparison between black and white folks, because there was no way that there was any competition, but based on the particular factors that are attributed to black folks versus the white folks. I want to give you another one, women and men. It got to a point where there was no even reason to compare these two, such that when we talk about chest pain in terms of heart attacks, that's the cardinal symptom. However, when we started looking, when we started being concerned that there is a difference between men and women, that actually abdominal pain is often the presenting signs of heart attacks. These are things we didn't know, and we would not have known had we not stopped making the judgments that there was not even worth looking at the difference between men and women. Well, okay, so you say, okay, people stop making comparisons. Now, we would otherwise call those stereotypes, but we'll go on past that and say, well, what does that lead to? What difference does it make if there's a stereotype? What that can lead to, however, is a state of desperation, right? If you happen to be on the side that is being disparaged against, all right? So my point of the lecture today, or the speech here, is that disparate states being manipulated by artificial intelligence can lead to desperate states. Disparate conditions, when manipulated by the human objectives, the machines that determine these things, and the poor decisions that come from them, can lead to desperate states. Now, I know we live in a society where everybody wants to be alike, all right? I'll take it the AOA. Everybody wants to be liked. And people will say that the way to do that is to be like somebody else, right? There are those of us who are not very tall. We watch basketball, and so the idea is we're supposed to be tall. And if you spend any time on social media, they have a nice square parameter of what you ought to be. All women ought to be tall and lean and have nothing to do but to, be in other people's business. This is what you're supposed to. You're supposed to have leisure. Studying is not what you're supposed to do. And the men, we're all supposed to have about 5 or 6 different girls on our text screens. We are supposed to be super attractive and about 5 feet wide and 10 feet tall. These are the things that society tells us that we're supposed to be. Never mind that none of us look like those stereotypes. None of us start off like those stereotypes. You know why? because God has designed us for specific purposes. He did not design us for TikTok memes. He did not design us to be liked the most on Facebook. He designed us for very specific purposes, and such that if you leave your states of disparity and you view them as prisons and as terminal life sentences, you will not get to where you want to be. Instead, I submit to you, you would end up in those desperate states. So now let's talk about, though, how we can get away from these these health disparities, how we can get from mental disparities, how can we get from educational disparities. I think it's first of all by recognizing, first of all, that they exist. I'm a man. I have children. I happen to be a heterosexual man. I'm an African-American man. These are things that make me different from many of you in the audience. It doesn't matter. It doesn't matter. It doesn't matter. Because we're all charged with doing whatever we can. Now, in terms of health care, there are seven different lines that society draws for us. Well, first, one is race. And there's several races, not just African Americans and Caucasians. There are Asians and those that are Latina and Latinos that exist. So first of all, I want to talk about just race not being just binary, but it is a graded scale on which all of us are going to find our ways on. Now, it depends on what your particular genetic makeup is and how those things came together, but you fall somewhere on the spectrum. Nothing wrong with that. But the important thing is that me identifying as an African-American man allows me to interpret, not be sentenced, to interpret, to understand, not be sentenced by my race. Now, there are 6 others. I'm going to just go through them just so that you're aware. Of course, gender is one, men and women, sexual orientation, age, disability status, socioeconomic status, and geographic location. Yes, some people will divide you and say that you are at a disadvantage because you're from the country. I happen not to think so. I can change my own oil. I can change my tires. I feed my cows every other week. You know, these are not disadvantages. But your awareness of these things is not a prognosis for failure. I just cannot tell you how important that is. I graduated from Raymond High School. We had about 112 people in my class. Only 7 of us went to college. Only 2 of us finished. Now, the other folks that did not do that, what else did they do? Oh, they went to the military. Some of them got jobs welding. They wouldn't, some of them did, they started being truck drivers. But now that I see those people who had a determination that they were going to make it anyway, they are doing just fine. They've got families and successful children. They've got lives that they are now showing fruit so that other people can benefit from. So no matter how society tries to divide us, I just want to let you know that none of those things are disadvantages. They are your unique set of skills to be able to succeed with. Now, let's get into some of the data, though, that is related to African American health disparities. Now, they are not all so good. Now, the good thing is that all of us die. All of us die. Now, it doesn't matter whether you're a black or white man, or woman, gay or straight, all of us are going to die. The question, however, is how do we find our ways to the grave? We try not to leave here earlier than we want to, and we try not to do anything to speed that up. And, based on the soda machines that are out there and the cigarettes butts that, I see littered across the campus, there are people who are making mistakes. I just implore you as young folks not to make those. But let's talk about it. And the fact that they are tying us down as an African-American community from the cradle to the grave. When we look at the fact that more than 30% of preterm births happen amongst African-American women. Cesarean sections are disproportionately high in African-American women. And then when the children, if they manage to be born, get through being born premature, then we have to face a number of things, including the fact that African-American men are the highest risk of categories to unintentional injuries, homicides. If you look at all 10 top leading causes of death amongst every division of race, the only one that includes homicide is amongst African Americans. Now, there are several others, cancer and infections and several other leading causes, but only in African Americans is it in the top 10. This is something that we've got to do something about. This is something that we cannot ignore. We cannot be cavalier about the way we approach guns. We cannot be cavalier about the fact that I need respect. Respect, right? So we talk about respect in terms of defense, but we never talk about respect in terms of offense. How about we respect ourselves in the way that we eat, and we respect ourselves in the way that we treat ourselves. We respect ourselves in the way we apportion our time, and we respect ourselves in the way that we build good relationships, monogamous relationships. I'm saying to my African American men, monogamous relationships. Now that hadn't been something I was always able to brag about. I've been in college, I've been in school, but it was something I had to learn. Part of the pathology in our communities is in the fact that African American men are programmed, we receive artificial intelligence that somehow being a player, a pimp, a playboy, a hustler, whatever that is, includes the manipulation of women. Can I say that again? Something about our society wants to create an artificial intelligence and sell it to us. That something about us has to have several women on our arm. This leads to all kinds of pathologies. The children that are born because of that, and the women that suffer the pain because of that. The failure to develop relationships, and how about this? Just a waste of time. It's just a waste of time. But I'm gonna tell you, I'm just gonna say that, and it's not just African American men at this point. It has leaked over to African American women, Caucasian women, Indian women, Asian women. There is something in our society that wants to program us that relationships are not important. And I submit to you that the persistence of disparities in our African American communities is not just because of neglect. It's not just because we don't have enough hospitals, not just because we don't have enough clinics, but it's our programming in our mind. We are hurting one another, and are not bent to helping one another. And I'm hoping that I can encourage some of y'all. Some of y'all are high school students still trying to determine what careers y'all want to do. Some of you are here on campus, hopefully pursuing healthcare fields. But let's do something that helps one another. It's not about the money. It's not about the money. And I know y'all saying that. You'll say, well, you already got your job. You already doing what you need to do, right? And I want some too. I'm tired of being broke. I'm tired of not being able to get the latest iPhone when it comes out. I'm tired of not being able to put my feet in Louboutins when I get ready. I'm tired of not being able to carry Louis Vuitton whenever I get ready. But my point is that all of those are part of the artificial intelligence that is programmed into us that keeps us from being able to take care of one another. But now let's approach this specifically. Let me give you some real specific guides about how we can defeat the fact that disparity gets manipulated by artificial intelligence and then leads us to being in desperate states. Now y'all seem like that only happens to me, right? Or that I've only been in that situation. But I'll tell you, that's what happened to Adam and Eve. When you think about it, when Adam and Eve found out that they were different, I'm a man and you're a woman, right? Then Satan was able to take advantage of that and create an artificial intelligence like you ain't got to follow what you think. Actually, you can eat from that tree. And subsequent to that, that led to a mistake when they ate from that tree. But it wasn't actually that led them to actually have to stay that kicked them out of paradise. What made them have to not be in paradise was the fact they kept making mistakes. That artificial intelligence just kept feeding them this false information that led them to actually stay there. I'll tell you another episode of where disparate states, being different, has been manipulated by artificial intelligence to lead to states of desperation. We cite since the early 90s that African American men are statistics, all right, that there is a hunt, and that African American men are at a higher, they have higher rates of incarceration than anybody else. It's just a flat-out lie. I'm going to tell you, it's just a flat-out lie. The actual truth of it is, if you think about it, if you take two jail cells, you put one person in one jail cell, and then you leave somebody in the other one, okay? Every time you go and check on them, if you go every day, the fact that people leave one jail cell frequently, that jail cell might have had 30 people in it in 1 month, right? The other jail cell, because African Americans do get higher rates of sentencing. In other words, if you do something, you're going to stay there longer. That in the African American in that second cell is just there all the time. So in that 1 month, it'll look like that the rates of incarceration are equal, because in one jail cell you'll have whites with shorter sentences, and you'll have African Americans with longer sentences. But actually, in that time, you had 30 people that came in and out of jail in that one jail cell, and only one in the African American. And this was a statistic that was manipulated way back in the 90s, but we have programmed it into ourselves to make us think that the jails are disproportionately African American. Actually, the fact of the matter is they do reflect a little bit higher proportion than the general population, but most of the folks in prison are actually Caucasian, just like most of the people in America are actually Caucasian. All right, so these things, whether it is way from the Bible or it is now when we talk about the states that we're in, we have been programmed by these states of artificial intelligence. But let's talk about healthcare. So if we talk about artificial intelligence as being a machine, then the first thing I want you to do is to reflect. What kind of machines are working in your life to lead you to make bad decisions about your health? Now, I talked about the soda machines, the snack machines, but there's more than that. We used to have cigarette machines, but they got rid of those, but we never stopped smoking, right? Because that means that it was in our mind. We can talk about guns, which, are like, this defines the way that we defend ourselves, but it actually creates pathology. Whether you shoot a bullet or not, the fact that you believe that your safety is determined by a bullet is a pathology. These machines set us up for the next phase, which we lose sight of the human-directed objectives. Human-directed objectives. Now, that's a complex term because there's two parts of that, right? There's a human, and then there's the objective. You have to ask yourself, after you say, okay, which machines are manipulating me? Which humans are manipulating me? Now, the question is, are you ready to be the human that sets your objectives? Or are you content with allowing other humans to determine what your objectives ought to be? And in terms of health, we all want to be fine, whatever it is that you define that as. We all want to be skinny enough to fit the latest fashions. We all want to be able to fill out our tight medium shirts. But the point about it is not the way we look, it is how healthy we are. If you never lose a pound, the diabetics prove to us, diabetic control of your sugars is improved just by exercise. If you never lose a pound. And I'm going to tell you on the reverse, if you go to the gym thinking that the motivation you need is to lose weight, you're going to lose a little weight when you first get in there. First of all, you're going to be discouraged because people who've been at it a long time, they up in there like God, they look good. I can look like that too. But it takes a long time for them to do that, right? So if you go in there thinking with this vanity, with objective that somebody else has given you, you're not going to stay there long. However, if you think about it, the way that I had to learn to think about it, my objective is to be here for my children. My objective is to be here to take care of my parents. My objective is to be able to take care of my patients. My objective is to try to get y'all to not make the same mistakes that I do. In order to do that, I got to have some energy. And I can't look like I'm right here tired and I don't want to be bothered. I got to be able to meet the public wherever they are, and I've got to have a great attitude to do it. Exercise is my way of doing that. I had to transition my way of thinking from just an objective to look good to actually an objective of being good. Do you understand what I'm saying? You can't just look good. It's not enough to wrap yourselves in the accoutrement of society. It's not enough to find yourself participating with the commercialization of our resources. We have got to be good. And if you can be good, then you can stay good. But if you do, based on what everybody else says, what TikTok tells you that it is, if you're following nobody's on Facebook no more except for people. Y'all have fake accounts that y'all let y'all's parents see. But on Instagram, I guess, and Snapchat, But if you're following those, if you're following social media's determination of what you ought to be, you're not going to be good. You're going to end up more aware of your differences. You're going to end up aware of your disparity. You're going to then be prone to let artificial intelligence program your mind, and that's going to lead you to a desperate state. No Louis Vuitton, no Louboutins, no Yeezys, no Nikes, no nothing, because you ain't gonna have enough money to eat, much less put on your feet. All right? So after we, first of all, change the machines that control us, and then we turn around and we change the human and objectives that determine how we think, then we can start looking at changing the predictions. Because when I tell you that 30% of all the preterm births are in one, you say, man, should I even worry about getting pregnant? If I tell you that African American men are 30% as likely to die of a stroke, you start thinking, why should I even try? If I put the cigarette down, what difference does it make? And this is the state of desperation that I feel like many of us are in when we talk about healthcare, because things are bad. Not just bad in healthcare, they are bad no matter where you look. If you turn on the news, 15 minutes of bad. If you open it, y'all ain't reading no newspaper, I ain't gonna go down that. But I don't care where you look, there's always somebody telling you that you are bad. If you weren't born rich, you are bad. If you don't look right, you are bad. Well, we have to start changing these predictions in our lives. This is the whole point. This is the whole point of all your parents, all of this Black history, all of what Carter G. Woodson wanted us to do was to change the ways that we start to make prognosis about our lives. You know, just because you fat don't mean you ain't gonna find no man. And just because you skinny don't mean you are gonna find a man, right? Just because you tall doesn't mean that you're gonna find a woman that is going to be good for you. And if you are short, it doesn't mean that a tall woman is not going to treat you like a king. These things that we hold against ourselves are prisons that we need to find our ways out of. And if we don't, there will always be healthcare disparities. There will be sex disparities. There will be gender disparities. There are going to be socioeconomic disparities, because we've got to get ourselves out of our individual prisons. We got to make new predictions, new recommendations for ourselves, new decisions for ourselves, so that we can get up and change the world. When you find yourself asking the question, what difference does it make? The question is not what difference does it make? The question is, what difference can I make? Do you understand? Everybody in here, it only takes one person up in here to find out, to make up their mind, look, I am going to be the next greatest nurse, doctor. I don't care if you draw blood. I am going to do whatever it is that I do better than anybody else, and can't nobody do nothing about it. I want us as young folks. Now I'm on the other side. I still feel like I'm a young fella, but I ain't young like I used to be. But y'all, the ways that I listen to the radio, man, I listen to everybody. I don't just pick and choose. The ways that I hear people talking about, I shot at your mama and now I don't hear from you. All these things, they are just very terminal, and they don't give you a lot of hope for life. So where do you find it? You got to find it inside. You got to find it inside. No matter if they tell you that you're a woman and you can't do it, you got to find it inside. No matter if they tell you you're African American and you're sick, you got to find it inside. No matter what they tell you, you got to find it inside of you. Inside of who? Inside of who? Y'all ain't convinced about that. See, it's like I just introduced. Inside of who? Me. That's right. It's got to be inside of me. So look, I just want to leave you with the idea, though, that in this world that we live in that's full of disparity, we got to dare to comfort those people who are not comfortable with their differences. In a world of despair, folks who don't have no hope, we got to dare to dream, and we got to realize that it's in me that I can heal me, and not just me, but others. In a world filled of machines of hate, we still got to dare to hope. In a world of artificial intelligence, we got to believe in a higher calling. In a world of harm, we still got to dare to heal. I appreciate your time, and for the sons of slaves, I appreciate your ability. I appreciate your being willing to let me serve you today. Thank you.
First of all, I want to thank everybody for coming out and sharing Black History Month celebration with us. And above all, I want to thank Dr. Green, my dear friend, for sharing some valuable information that we can all glean from. And we're going to have Dr. Green, along with Shakita Berry, who's a nursing graduate of Bevel, and also a past clinical instructor of Belleville. They're going to answer any questions because I'm sure many of you are interested in the healthcare field. We don't have a whole lot of time, but we will provide some time for your questions. Thank you. And that concludes our program. We thank you for coming and have a great rest of your day.
Man, this came with
And
a cup.
that's just a total of our appreciation.
I appreciate it. I appreciate it.
Beverly.
Oh, take a